Sorry for that problem, guys. I think we got our sound fixed now. Please let me know if you can hear this. I would welcome you again. Thank you so much for joining us today on the update. Remember, you can type your questions in the comments section during the live update. If you don't want to ask your question during the live broadcast, you can always email us at info@dadecounty-ga.gov. Thank you so much for coming to the right place for the right information. Today, we'll be hearing from Alex Case, who's our EMA Director, from Ted Rumley, the County Executive, and Stacy Stevens, who's our Parks and Rec Director. If you know someone who would be interested in hearing from any of our guests today, go ahead and invite them to watch this live broadcast or start a watch party so you can hold your own discussion. Remember that you can also watch this later on Facebook or YouTube, and sharing the links to our videos is super easy. Also, remember, if you're checking out calendar events and what's going to happen in the county, what's coming up, you can always check our calendar at dadecounty-ga.gov. We will be talking extensively today about COVID vaccines and the availability and how that is working in the State Department of Health, our Public Health Department downstairs, which is our local branch here that's located here in Dade County. So we will be talking about that at length today. So if you know someone who could benefit from hearing that, we will be answering many of your questions about that today during this broadcast. We will go ahead and start with Stacy Stevens, our Parks and Rec Director.
Hello, I'm Stacy Stevens. I'm Director of Park and Recreation here in Dade County. I just wanted to touch on a few things that we're doing at the park and some upcoming events that we're going to have. Right now, me and my guys, we're remodeling some bathrooms, doing some painting, replacing some windows, and fixing a lot of maintenance issues that we've had. And also, I know it's been a pain for a lot of people that live on Sand Mountain, but we were able to get right around 200 tandem loads of dirt to put down at the park to extend one of our small ball fields to enable it to be able to accommodate some older age groups. And that's going to be an ongoing process through this spring and part of the summer until we get ready to open it back up. A lot of people have been calling me about baseball sign-ups, soccer sign-ups. The baseball right now is a go. Everything's planned to go as on schedule. They have not started or decided on a opening sign-up date yet. If you would, please check the Dade County Rec Baseball Facebook. They will continue to update that and give out information. Also, our Rec Soccer has got on some banners up here in Trenton and on their Facebook page when they're going to start their sign-ups. And as soon as everything gets going, hopefully nothing else bad happens, we'll be able to have some good spring sports. Also, this year, starting the last weekend in February, I think it's the 27th, will be our first tournament down there. We're working close with a gentleman that has booked the park for 15 weekends. And that will start on February the 27th. There'll be more information about that. I'll get with Carey and we'll get it on our website to, if it's boys tournaments or girls tournaments, we're going to have a mixture of both this year, and when everything will sign up. And if anyone here in the county would like to do a tournament themselves, please contact me at 423-290-8415. Thanks.
Good afternoon, everyone. I'm Alex Case, Director of Dade County Emergency Services, and for probably the last almost 5 months, we've been working on requests for proposals and then negotiations and contracts for EMS service as our provider for Dade County. For the past 9 years, we've had a private company of Puckett EMS, and we are switching this Monday morning at 6 a.m. with Memorial CHI Georgia, which is at the old Hutchison facility, as they rent that facility and made an investment into the North Georgia area to be our ambulance provider. They do have an EMS division. They will be providing service for Dade County and Walker County. We've been meeting very heavy the last month, and really every day this week finalizing posting plans, which means that we'll be covering Dade and Walker County with these 7 ambulances between the counties. We are unique in our area because of Tennessee being on our north end of our county and Alabama to our west. We can't rely on other Georgia agencies to help us. Our only agency is to the east, and because of states and laws, it prevents that. So that's another issue as a corner county in that state that we have to do. So it's why we work really heavily with Walker. Both our 911 employees, 911 center employees have met Tuesday and Thursday as we lay this planned out, get the input from our employees, which we've been doing that for the last few months. But we want to ensure the citizens and our visitors as they come through that emergency services, one of the goals that you hear or you may run into that what we do as emergency services is protect life and protect property. And this is part of that life protection that we're providing for our citizens. You will be seeing you've seen them before. Dade County will be providing 2 ambulances 24/7 as part of our contract. And they're white with blue striping and red lettering. We have 3 of those, and we have 1 that's red that's still got the blue striping and white lettering. So they are carrying our American colors of red, white, and blue. We picked this scheme back in 2008 when we lost Hutchinson EMS, and at the time the county had to go in and fight for the zone that we can control who provides services of Dade County and how much they charge us and the taxpayers for traveling, carrying someone to the hospital. That's what, as a county government, that we control that zone, that we negotiate that with CHI EMS that we're doing with now. So that's part of that goes for they can operate in our zone. So I just assure you, it's really been taken up of a lot of our time. And again, there's a lot of people helping with this. Been very pleased with the EMS director at CHI, his operations captain, and all of the lieutenants and captains that's this. Monday, Tuesday, Wednesday, and Thursday, they have been meeting with all the current employees and new employees that's going to be working in Dade and Walker. I got to meet them. We talked about our goals. We do have contingency plans like we've done. We've done this with Puckett, and we just reiterated with our new provider that we're always looking for worst case scenarios. We do have mutual aid contracts with Walker does with its neighboring counties, and we also mutual aiding contracting or having a mutual aid agreement with Puckett EMS. They will continue to provide service in Catoosa County, and they may need help as well. We always help our neighbors because we deal a lot with these 3 counties. They're part of our regional commission. We know those commissioners, the same EMA directors like myself and EMS directors. We work together and help each other through fire, law, and EMS. Just want to assure you I appreciate everyone's thoughts and prayers of this. It's a tremendous load, but again, it's shared through a great deal of people. Our dispatchers will be having to learn new numbers of the ambulances and the new policies and what we call posting plans when we get limited times. I ask you to remember your volunteer fire departments in your communities because they also render first responder assistance. These folks come out and spend their time to do basic level of care until the advanced life support ambulances get to them. So always thank your volunteer fire departments. Our EMS folks, as they're here, we do have several that are staying with the company with Memorial. Some are continuing on, but they'll still be here to help with Dade EMS. If we ever have a need to turn one of Dade EMS's trucks up, we always have that, I call it our crutch whenever they get so busy. There's times that we've seen these since 08 that all 3 or 4 or 5 counties are so busy, and we still continue to have long turnaround times with COVID exposure and COVID positive patients. It takes longer to wait at the hospital. the cleansing of the EMTs and the paramedics, the trucks, the stretchers, the monitors, the pads, it just takes a long time. And it's taking longer to pick somebody up, get them to the hospital, and get back. We're adding an hour and a half to 2 hours sometimes on these calls, and then they still got to get back, and sometimes they have to change clothes and wash the other ones. We got procedures for that. So again, thank these folks, and again, we're continuing to do our best and provide the best care of service we can. These commissioners, we had to make some hard decisions, and this is costing us more than what we paid in the past, but we've been getting since 2008 and beyond, we've been paying around $150,000, and just as this past year, moving up different, but our budget, we're working hard to make sure that it stays where it is. So we appreciate the commissioners. We appreciate everyone that's there, and hoping that we provide this service. And if you ever have any questions, please give us a call. Our information's on our website. And all the information, again, that Carey has talked about, Ted talked about this morning, and what you're fixing to hear again with this COVID and our vaccines, this stuff is working very well. We got a lot more volunteers in here helping, and then even helping with the phone calls, and a lot of things going on. So please, pay attention to what's fixing to happen, the information they're giving, and I appreciate everything. And if there's any questions, please let us know.
Good afternoon. Beautiful day outside, a little cool though, but I'll start real quick and give you an update on a few things here, and then go into the COVID. We've got a lot to talk about on that. I did mention County Road 6 this morning. We're still on schedule with that. Everything's, the weather is working with us real well. They're working up there. But we're still looking at middle to end of February, hopefully, unless we have a bad February. So we just need to play it by ear. But believe me, we want it open as much as you do, the people who live out there. Department of Driver Services, they'll be here next on February the 8th. That's try to make an appointment if you possibly can. We have a number posted you can call. They will not turn you away though. If you just come down, you might have to wait a little bit longer than normal, but they will be on February the 8th. The elections had just announced a special election for the school, the E-Splosh. That's going to be on Tuesday, March 16th, 2021. And the dates, the advanced voting hours will be posted online on our website. Advanced voting will be held here in the administrative building just like before. Of course, on election day, that'll be Tuesday, March the 16th, and all precincts will be open then, just like we do standard on a standard election. You must go to your actual precinct and vote on the 16th, but as always, during that time of the early, that's why we do that, is to give you a chance to come in at your convenience in this building here and vote. So you can come in at any time during the building hours. Dade County Sheriff's Office, the lobby's still closed. They haven't announced when they're going to open it back up, but they have started the fingerprinting process Monday, Wednesday, and Saturday from 2 to 6. And if you've got any questions about that, you can call 657-3233, area code 706. And so just, that's mainly when they say fingerprinting, some people don't understand what that's about, but that's to do background checks or any kind of the firearms permits and all that. So they are still able to do that. We do have our charging stations open down here at Georgia Power. Mentioned that last week or so, and there are some people I noticed that have already started using it for your electric cars. So if you do have an electric car, that's just right down in our parking area of our courts facility. The Tire Amnesty Day, that's a big thing. We really happy last week when we announced, that it was going to be on February 27th, and everything was fine. And then Alan and all, they were notified. I think it was Monday. I believe they got the notification this past Monday that the state has changed that. I don't know whether it's COVID related or whatever, but they just out of the clear blue sky, they've changed it. They have not given them another date, but we will keep you updated on that. So it's not going to be on February the 27th. We had a date there set, and they did, but for whatever reason, and there's a lot of things, going on here. I'm sure that probably this may have been COVID related. I don't know, but a lot of things are different now, and even our meetings, that we have, regional commission meetings and different things. We're living in a different time, so that I wasn't surprised at this. But anyway, go ahead and move into our COVID report here. As far as the testing downstairs, they're still testing on Wednesdays, drive-through. The testing that we're doing 5 days a week, the actual quick test, as some people are calling it, they're no longer doing that in any of our counties here. Not Dade, Walker, Catoosa, Chattooga, any of our counties, because they're so busy administering the vaccine. That right there, when they first started that, just a few last week, a lot of you had problems, calling in and all, and we've talked about that, and it just overwhelmed our people downstairs. They were doing everything they could with the people they had to do with, and now we've kind of the commission. We've got some people. We went ahead. I called Friday of last week to Rome. They worked with us. They set up I think 5 stations right now we've got down there. I think they're manning 3, but it's really helped down there. We've got a lot of volunteers. We've got 3-4 people there that's able to go down just mainly to answer the phone and take appointments. So it's kind of took some of the burden off the people that are administering the shots, and they've had several volunteers come in. Some of our people that have retired. They came back, and I know it's a blessing to them, because it was really to a point. It was really nerve-wracking for them, and a lot of people are still, and they were scared. They'd call, they'd get hung up or whatever, and they just just something that anything new like that, you got to just work around it, and we feel like we've got it going pretty smooth right now, and they are a good bunch of people downstairs, and. But when you open the floodgate to someone like that and just overwhelm them, you can only expect them to do whatever. You can only do so much in a day, and you know that. So, but the vaccine, it is very scarce. They make appointments by the number of vaccines. They will not make appointments until they know exactly how many vaccines they have. I think today, Carey, they're giving 80 shots. Is that right? 80.
Today they're doing 200.
Oh, 200. Okay. Ooh, okay. So, from what I understand now, this morning, did you tell me that they're already making appointments for the second round? Didn't they get a few?
Yes, that begins tomorrow.
Okay, tomorrow. So, but that has changed also from what you were told when you got your first shot. They will call you. We got enough people down there. They do that to helping. And they will call you and make that appointment, tell you to come in and work with you on that. You don't have to call in. Before, they told you that you had to call them. And so that's changed. That's one thing that's actually changed. And I think it's changed for the better. I think, people, they know, when you do call, you can, and I guess you kind of work with them, don't you, Carey, on an appointment, because you're one of the people that's, as far as, if they can't come Friday or whatever, you kind of help the people.
We try.
Yeah.
So they do.
Yeah, turn your mic on.
The second round, and a lot of people were really worried that they weren't going to get the second round. You can go between 28 and 42 days to get that.
Yeah.
To get that second round vaccine,
Yeah.
But they do have the staff now to be able to call and make those second round.
That's good.
appointments.
Yeah, because a lot of that 28-day number is in a lot of people's mind, but and I didn't know this till you said that. I think yesterday you were talking about, but you can go up to 42 days, and that kind of relieves people. But don't worry, that if you've got a shot, you're going to get called. If you had the first shot, you're going to get called and be and set up for your and it will be within the time frame. So don't be worried about that. I mean, they're okay. Let me read you here. When you do call, for those of you that haven't, you'll be asked a few questions, and these are just generic questions that they have. Like if you call, say Carey answered, one of the ladies down there, or we got a couple of guys working too, and they'll ask you, simply, are you 65 or older? Are you a resident of the state of Georgia? That's another thing too. I will mention anyone in the whole state can come. That's why people couldn't understand why we were getting 1,000 calls or whatever, from just Dade Countyans. Well, it's not. We cannot turn down anyone in the state of Georgia. And a lot of people they go on the websites, they've got, and they may be in Athens, and they may be out of that down there, and they get up in the morning or at night and they look and they say, hey, Dade County's got 1,000 doses, or they're taking appointments. Well, if they make a call here, they'll give them an appointment. They can make a day trip up here and back. And most people are retired, anyway, that age, and so it's not just Dade counties that are getting these shots and are making these calls, and that's one reason it was so overwhelmed. Just like Dade and like Walker and Catoosa, they were, I think the first one, Shannon said the first day they opened, before they had this call center, they received the first day, and this is when before they didn't really realize they received 4,000 calls in Walker County. And Alex, what did you say now that they actually got the first call day when they had the 20? It was unreal. It was like 1,500 calls in like 3 hours or something like that. But so it's not just it's not just the people in Dade County. It's everywhere in Georgia. Now we don't you've got to be a resident of Georgia. The other question is have you had the COVID in the last 90 days, and have you had a vaccine of any kind in the past 14 days? That's anything. That's whether you had the flu shot or whatever. You need to answer that. And some people, and I know they tell you, and they don't understand why. They're saying, if you just say, like I tested positive, and I was 65 or whatever, they're telling you, you've got to wait 90 days before you can receive the vaccine. Well, it's the reason being, and there's 3 different doctors have told me that. Actually 4. I talked to one ago when we were talking about it, but it doesn't have to do with actually you having too much of the antibody in you. It's the idea that in 90 days they know for sure you're not going to get this, and and in 90 days a lot of things can change, and that gives people that do need it out there, that gives them a chance to get the shot. So yes, you can wait. You can get it, I guess, after well, all my doctors said if you wait 2 or 3 weeks after you don't have any symptoms. It's not going to hurt you to get it. But the idea behind this is you've got a lot of people there that are coming in that really need it, that could get it, and for sure for 90 days, hopefully longer than that you're not going to get it. You're not susceptible to it. Let me see here on these notes. Carey, have I left anything out? Because I want, it's just a lot to talk about.
It is.
There is a reason too, so I had people ask, and Carey's got this on here. They're saying, well, why did they come up with 65? Because Tennessee and I think Alabama, Evan said this morning, you can't get it unless you're 75, or older in those 2 states. Well, what Governor Kemp's looking at is, according to CDC, 14% of the positive COVID cases are age 65 plus. But over 80%, it's 80 point whatever percent of the COVID deaths are people that are 65 and plus. Now that's people that actually have died. So that's what they're going by. That's what he's going by here, and that's how they came up with this. And what we're in right now, they're calling it, we're currently in phase 1A plus of Georgia's COVID-19 vaccination plan. Now I don't know, and he only knows, I guess, when he's going to go into the next phase of that, and the next phase of that will bring in different people, different age people, I guess, or whatever, But that's something we'll just have to bear with.
And
Did I left out anything?
That's Governor Kemp who
Governor
comes
Kemp.
up with that, and so he and Dr. Toomey will decide when it's going to
That's
be
right.
phase 2. And when they do that, we'll share that on this update, on our Thursday
Immediately.
update that we do
That's right.
every week. But one other important thing is that if you get the first vaccine, for the first dose of the vaccine as a Moderna vaccine, you do need to get that second one as a Moderna,
That's
and
right.
the same for Pfizer.
That's right.
And then the other thing is that if you do make an appointment here to receive your first vaccine, they will go ahead and call you when it's time to receive your second dose.
Mm-hmm.
So, and it's very, very limited. We don't know from week to week how much we're going to get. So just be careful. If you are able to get a vaccine appointment, keep that appointment.
That's right. Try
Don't
not to
lose that
cancel.
appointment.
Yeah. Well, if you have to, because of sickness, because some people can't make it, try to let them know, not wait till the last couple of hours or even that day really before, to cancel it, because the thing about it is once they actually put these out and it thaws, goes through the thawing process, they've got to use it. And if you wait till the last hour there and you say, well, I'm just not going, and they've got to do something. They'll call, they'll give that to some. They're not going to do away with it, but it's really important to keep your, if you make an appointment, keep your appointment. And as she said, it's very important. Like if you get kind of aggravated or whatever, you think, well, I'm gonna go find my second shot somewhere else. If you do find it, you need to keep the 1-in-1. If it's if you get what's the other one that's called?
Pfizer.
Yeah, you don't want to mix them at all. And but you shouldn't have to do that, because each allotment is allotted by 1-on-1, 1-in-1. If they give 1,000, the first go round, they've got 1,000 number 2 shots coming in for you. So it shouldn't be any reason to do that. But I bet there's people I bet throughout the United States it's happened. If you have any questions, I know a lot of you do. There's some things I know we didn't touch on, but just call us and we'll be able to, Carey, go on the line, or you can call me, call her, or whatever. Just want to stress, that we do appreciate everyone down there that's volunteering. We got people bringing food. Our churches are turning out, bringing food. There are people downstairs working, and that shows what Dade County is really. We've got people now that stepped up and volunteering, down there for the call center and everything. So it's going. Carey, I think, you're down there every day. It's pretty smooth. Right now, knock on wood.
It is.
Yeah, okay. And we do appreciate our health people downstairs. I'll go into our COVID numbers here in Dade County. We are at 933 positive cases since March right now, total. Last week at this time we were at 891. We've had actually 62 tests positive in the last 2 weeks, in the last 14 days in Dade County. We've had 8 deaths here in Dade County, and we've had 47 hospitalizations since it actually started. Walker County, last week they were at 4,728, and today as we speak they're at 4,972. Now they've had 331 positive cases in the last 14 days. Catoosa County, they were at 4,125 last week. Today they're at 4,369. They've actually had 343 cases, positive cases in the last 2 weeks. Chattooga County, they went from 1,850 last week to 1,930. They've had 160 positive cases in the last 2 weeks. Whitfield County, which is a big county, they were at 12,775 last week. They're at 13,218 as we speak. They've had almost 1,000 people in the last 2 weeks. 997 people tested positive there in Whitfield County in 2 weeks, 14 days. Gordon County, down at Calhoun, they were 4,809 last week. They're at 5,084. They had 372 in the last 14 days test positive. Floyd County, down at Rome, they went from 7,970 to 8,394 as we speak. In the last 14 days, they've had 588 positive cases reported. Right now in Georgia, there's 3,319 unknown, says unknown counties, but that's addresses that haven't been tied to counties. And we've had a total of 12,135 deaths since March. That's up from 11,411 a week ago. Move down to Tennessee, Hamilton County. They actually went from 35,049 last week to 36,369. They have at this time, right now as we speak, they have 1,849 active cases in Hamilton County. And they've had 34,165 that's recovered out of that 36,369. They've had 355 deaths. Marion County, which is one of our close neighbors here, last week they were at 2,308, and today they're at 2,382. They've had 135 right now active, and 2,213 recovered out of that 2,382. They've also had 34 deaths. Grundy County, they were at 1,403 last week. Now they're at 1,449. They have 61 active cases. They've had 1,364 recovered with 24 deaths. Sequatchie County, they were at 1,383 last week. They're at 1,431 as we speak. They have 86 active cases today as we speak, and they've actually had 1,325 recovered out of that 1,431 with 20 deaths. Meigs County, they went from 1,164 to 1,227. They've had 1,111 recovered and 17 deaths. They have 73 active right now. Bradley County, they're at 10,934 last week. Today, as we speak, they're at 11,378 in Bradley County with 678 active cases. They've had 10,594 recoveries with 106 deaths. Okay. Move down to Alabama. Jackson County, one of our neighbors. Last week they were at 5,903. Today they're at 6,171 in Jackson County. They've had 62 deaths. 510 cases of positive cases have been reported in 14 days in Jackson. DeKalb County, last week they were at 7,796. Today they're at 8,052 with 130 deaths. They've had 478 cases reported in 14 days in DeKalb County. This is, the numbers, every week keep going up. I mean, and pretty much the only thing you can do is, number one, if you're 65 and older, or down there, if you're 75, we go try to get your vaccine. But wear your face masks and try to abide by the 6-foot rule. And be careful, when you're in church or in any gatherings, weddings, or even in restaurants. A lot of the restaurants have went back, to full service, or they've got some of the tables blocked off. But a lot of them haven't. A lot of them have actually closed again too. So we just need to, just kind of be safe and then use common sense. That's a big thing. Alex, you got anything that you think of that you may have left out?
I have one announcement from the health department, and then we have some questions.
Okay, go ahead. Okay.
One thing that the Department of Public Health downstairs wanted us to talk about was how to make an appointment when you call in and how to make that appointment. And, for those of you who don't know, that is a state department downstairs. It is the state of Georgia Department of Public Health. So this is a wonderful partnership that we're able to do with our Board of Commissioners, helping supply people to work downstairs and work with that different agency. So that's a wonderful thing. I love to see our community come together like that. The church is bringing meals, volunteers who are helping, in times of pandemics and in times of crisis. We all have to pull together to make things work the right way, and it's very encouraging to see that happen. They wanted me to mention a couple of things. When you make your appointment for the vaccine, remember we are in phase 1, so people ages 65 or older, healthcare workers, including physicians, nurses, laboratory technicians, EMS personnel, environmental services, etc., residents and staff of long-term care facilities, caregivers of someone age 65 or older, and that's a primary caregiver. So that's you are the only person who provides care for them. They can't drive, they can't get out. That's what that means by being a caregiver. That's a very specific role. Also, law enforcement, firefighters, and first responders are eligible for this round. So when you make that appointment, you will need to come into the Department of Health. So a lot of people thought this was like drive-through testing or drive-through vaccines. It isn't. You do actually have to park and come into the Department of Health. It is located at 71 Case Avenue. So where you do early voting, it's on the first floor there, Suite 100. They do ask that you come in no more than 5 minutes early to fill out your paperwork. and that you be prepared to stay at least 15 minutes after you receive your vaccine. That's just to make sure that you don't have an adverse reaction, and so that if you do, there is a nurse there to attend you. If you do make that appointment, please do keep that appointment. The vaccine is extremely limited, and we don't want to waste those doses because someone misses their appointment. So how this works, and County Executive Rumley touched on this earlier, so the vaccine actually comes in. The nurse manager takes that, counts out the exact doses, and then she opens a block of appointments to meet that exact number of the doses. So this is like a finely tuned dance. Everything has to happen in just the right order. So please, if you are able to get an appointment, please keep that appointment. Unless you're sick, you of course call in and cancel or reschedule. We are only making appointments through Tuesday of next week. They do have about 30 appointments available next Tuesday, or they did at the beginning of this broadcast. We did check with them. So they had some left on Monday, some on Tuesday. So no more than 5 minutes early. Arrive for your appointment to fill out your paperwork, and then be prepared to stay 15 minutes after you receive your vaccination. Some people were really worried about social distancing. They are social distancing downstairs. They only allow so many people in at a time. So they're trying to keep everybody 6 feet apart, so they are making sure that people are masked. We have had a lot of people, again, we've talked about this before, ask when we'll begin phase 2. The basic answer is we don't know. That is a call for Governor Kemp and Dr. Toomey. That is not set by the state, the local health department downstairs. It is not set by this Board of Commissioners. It is not set by our EMA director. That is the governor of Georgia who sets that. So we know that a lot of you are very disappointed that you're not in phase 1. If you have an issue with that, you need to call the governor's office directly. That has nothing to do with anyone on a local level. And then remember, but if you get the Moderna vaccine for your first dose, you will also need that for your second dose. Same with the Pfizer. If you got a Pfizer vaccine, you will need to get that. And I do want to reiterate what County Executive Rumley said earlier. Part of the reason that many people were having trouble getting through to the phones is because so many people were calling from even outside the state of Georgia. Just this week, we had a gentleman who was ready to fly up from Florida to get this vaccine. We had a lady who called from South Carolina who was going to drive here to get her vaccine. So when we're telling you that there are calls coming into the Department of Public Health, we don't mean 1 or 2, we mean hundreds and thousands of calls. So please be patient. We believe we've gotten those all caught up. We haven't had a backlog today of calls, which is wonderful. Everybody is working very well down there. So don't flood the phones. You will get through. Somebody will answer your call. And just remember, though, the vaccine is very limited. We don't know from week to week when we will receive more. So if you get an appointment, please take it. We do try to accommodate your schedule, but that isn't always possible. So one more very important thing that you need to know is that if you do receive an appointment, it means that you will receive the vaccine. Nurse Manager Tammy Franklin waits until we have the vaccine on hand to open those appointment slots. We will not schedule an appointment for you if we do not have the vaccine on hand. Once all of those appointment slots are gone, you may leave your name and telephone number on the wait list, and we will call you back when more vaccine is received. And we've done that already this week. So some of you did receive those callbacks and were able to schedule your appointments. At this point in time, everyone who's called to be scheduled for an appointment who qualifies has received an appointment, whether we had to call you back from a wait list or whether you got an appointment right then. So please be patient, and thank you so much for the encouragement that you have given to our health care workers downstairs. Now, we do have some questions, and we will ask those right now. The first one is for County Executive Rumley, and it is, do you have an estimated time of completion for White Oak Gap?
Yes, we talked a little bit about a while ago. The County Road 6 or White Oak Gap Road, it'll be at least the mid-February till the end of February. It looks more like, the end of February. There's no, it's just a process that we're going through there, and it was in a lot worse shape once we dug on down. We found one major place that water was, it was, 8, 10, 15 feet deep that water was coming through, seeping through we weren't aware of. And we had to go back and dig all that out. And anyway, it's just a process that we're, there's no speeding it up. They're working every day. And if the weather lets us along, we'll keep on schedule. But it could go, to the end of February, on into March possibly. But it's got a lot to do with the weather, of this. Yeah.
Okay. The next question, I don't know if you want to address it or if you would like for EMA Director Case to answer this, but can anyone verify that the new linemen, the new group of students at the lineman school are still adhering to the rules that were set last April? I tend to see them in the stores with no masks. Are they still adhering to those rules?
Well, they're supposed to be. I mean, the rules were laid out when they had orientation, and what we'll do Thursday, we'll have one of the representatives from the school come on, and we will have him tell you exactly what's going on. And I'll get someone, either one of the owners or whatever, to come in. They have a safety director too, but I know that they have been and enforcing it. The ones I've seen in the stores have been wearing masks, but I don't. The only time I go in maybe quickly, to Ingles or something. But if that's the case, I wish that, my number is 6678999. And when you see this, call me. I mean, I don't mind it. And I'll call directly to the school and say, look, we got a problem. Because we need to start documenting this, So that's the only way we can patrol it is through you, So just do that. Yeah.
Okay, and the last question we have is actually about a possibly broken traffic cam, and we said we would ask this one to EMA Director Case. And we did ask the person for clarification if it was a GDOT camera, because of course that would belong to the state and not to us. But I personally am not aware of a broken camera. I didn't know if you knew what they were talking about.
There is 4 cameras, I think, along the interstate, one here at the main red light, and those are owned by GDOT. So if they are,
give us a direction of which one it is,
we'll be glad to. We've got a number we call them for stop signs and traffic lights and things like that we'll let them know.
Okay, those are all of our questions that we have today.
All right, we just appreciate everyone working with us here through this. We still got a long road to go, but be thankful and that we do have a vaccine now. And at least, a few weeks ago we were just really not knowing when it was going to happen, but it's in the process, so just bear with us and work with us on it. And if you need me for any reason, call me at 667-8999, 423 area code. You can call any of the commissioners, as I always say, because they answer their phone just like I do, and they're there to help you, and we're public servants. So we appreciate everyone working with us again, and just call us if you need us.